Ever wonder if your child's struggles mean they have a disorder, or why kids today seem to show more emotions than ever before? These are some of the questions I hear the most, and today I'm diving into them plus a few others right here on Bad Kids Don't Exist. Let's explore what's really going on with kids' mental health and how we can better understand and support them. Hey there, I'm Stuart Perry, but most people know me as Mister Stu. I'm a licensed clinical social worker, a child therapist, and an autism spectrum disorder clinical specialist. Here on Bad Kids Don't Exist, I help adults better understand kids so kids and their caregivers can thrive. Today, I'm answering 5 of the most common questions parents, teachers, and caregivers ask me about children's mental health. And I think you're going to find these insights as fascinating and helpful as I do. In this episode, we'll explore what it means when a child shows symptoms of a disorder. We'll talk about whether kids today are actually worse behaved or just expressing themselves differently. Then we'll go through the real meaning of co-regulation and how to practice it effectively. We'll talk about how to help kids separate their choices from their self-worth, and we'll discuss why progress matters more than perfection. Plus, I'll be sharing my original poem, No More Naughty List, which is all about helping kids see their inherent goodness even when they make mistakes. Before we dive in, take a moment to like this video, subscribe to the channel, and share it with someone who could use these insights. Let's make this conversation one that reaches as many people as possible. And let's get started with this question I get all the time. My child is showing some symptoms of ADHD or anxiety or autism. Does that mean they have the disorder? It's a really important question because it gets to the heart of what a diagnosis actually means. Let's explore the difference between showing symptoms and having a full blown diagnosis. And really, just to break it all down into a very simple statement, having symptoms doesn't always mean there's a disorder. There has been a huge surge of people discussing their disorders on social media. And that has been a great thing for so many reasons. It has helped destigmatize some of these disorders. It has helped people see that mental health is something we should all be talking about, but it has also caused some damage. It's caused some damage because sometimes people go on social media and say they have a disorder when really they've never been diagnosed with that disorder. They just are thinking that they've heard some things that make it sound like they do have that disorder. And the other thing that happens is people who actually are diagnosed, who actually do have a disorder, they go on social media and they share all about their disorder, and other people watch it and they believe that they can diagnose themselves based on what that person is sharing. They relate so much to that person, they feel like they also have the disorder. As a licensed clinician, I am not allowed to diagnose myself. I am also not allowed to diagnose my friends. If there's someone that I know in any context outside of therapy, I am not allowed to work with that person and I am not allowed to diagnose that person because our version of ourselves and of the people in our lives will always be a little bit tinted and shaded by our personal perspective. So if you are trying to diagnose yourself, you can't do it. If a friend has diagnosed you, they can't do it. And even licensed clinicians sometimes disagree about diagnoses. I'll talk about that in just a minute. But when we're talking about seeing symptoms of a diagnosis or having a full-blown diagnosis and really being diagnosed with the disorder, let me show you and talk you through a few things. If you are just listening to the audio, I will explain this to you. If you are watching on the video version of this episode, then you'll be able to see. What I'm holding up right now is a packet of 3 pages that are printed almost all the way on all 3 pages. The third page is only about a half page, but there are highlights all over the page. And the reason that I am showing you this is that these 3 pages of things are the diagnostic criteria for ADHD, attention deficit hyperactive disorder. People all the time will tell me that they can't focus and so they must have ADHD, or they'll call me and they'll say their child can't focus, or a teacher will call me and say that a student in their class can't focus, and that must mean they have ADHD. ADHD is much more complicated than not being able to focus. And if you're just listening to the audio version, that is me flipping through the pages of this diagnostic criteria. There's 2 types of ADHD. In this first type, this is the first type right here, and it's called the inattentive type. In order to be diagnosed with the inattentive type of ADHD, you have to have 6 different symptoms that have persisted for a certain period of time, that are persistent through multiple different avenues of your life, multiple different domains, school and home and different places, and it has to have started in your life at a certain time. The same is true for the hyperactive type of ADHD. You have to have 6 different criteria that are persistent and pervasive across several different environments that have gone on for a certain period of time and that began by a certain period of time in your life. It is not just about not being able to focus, but so many times people will call me and say, my child can't focus, they must have ADHD. When we're talking about autism spectrum disorder, there's 2 pages here, but the criteria are even much more specific, and it has to be that the person has all of the things that are highlighted here and almost all of the things on all 2 pages, and they have to be persistent and pervasive across environments. They have to have begun before a certain period of time in their life, and they have to have lasted for a certain period of time. If we're just talking about depression, it's not just about feeling sad. There are 2 pages here of highlighted things, and someone has to have had several of these symptoms for a certain period of time. Do you get what I'm trying to say? Here's PTSD. PTSD is 3 pages of things. It's not just that something happened and someone is panicking about it. Generalized anxiety disorder is 1 whole page of things that has to be met. Disruptive mood dysregulation disorder, this is one for children who often appear angry or upset a majority of the time, but it's so much more than that. When you look at these criteria, when you hear the pages flipping, when you hear me talking about this, do you understand it's not just about having some symptoms? There is a lot that goes in to having a diagnosis. And beyond all of that, a disorder has to be causing disorder in your life. So someone can meet all the criteria of a diagnosis, but if it's not causing any problem, we would not diagnose them with a disorder because it's not causing disorder in their life. It's so much more than just a few symptoms. It's so much more than just what you've seen in a 90-second TikTok video or a YouTube short or a Facebook or Instagram reel. It is so much more complex than that. Earlier, I told you a little bit about that diagnoses can differ between clinicians as well. I have had children come into my office and their parents will hand me a sheet that has all the diagnoses that their child has gotten before, and maybe they're diagnosed with ADHD and anxiety, and they're diagnosed as oppositional defiant disorder and conduct disorder and all these other things. And when I look at the person's history, I see that they've been through significant trauma, and the clinician left that out of the diagnoses. They didn't diagnose this person with a trauma disorder that can present as ADHD and anxiety and ODD and conduct disorder. They left that completely out. They just focused on symptoms. mental health is both a science and an art. And there's not just a blood test that you can take that will say, like, oh, yes, here is your mental health diagnosis. It is so much more complex with that. And I say all that to say this. Different professionals might disagree on the same behaviors, and that's okay because a diagnosis, a disorder, is not a fact about you, and it is not a fact about your child. It's an interpretation of what is going on in your life. And those labels are not to define you, and they are not to define who your child is. Those labels are to help other people understand better. If you went to the doctor and the doctor said that you have the flu, having the flu doesn't make you a bad person. It doesn't mean that you were broken or wrong or did anything bad or wrong. It just means you have the flu. And because they can name it, they now know the best course of treatment to support you. And that is what a diagnosis does for me and for others as mental health clinicians. And once we can give that diagnosis, hopefully that name to what is going on will help teachers and parents and all the others in that child's life to know the best ways to support them. It is not a label to say this is who they are, everything that they are is all wrapped up in this one thing, and it's not to say this is who they always will be. It's just to say, here's the thing that's going on right now. Because we have a name for it, we know the best ways to support them. And that is what a diagnosis does for someone. I say all the time that everyone should be allowed to see the world in their own unique perspective, in their own beautiful, imaginative, individual way. If you've seen my book is all about autism spectrum disorder. It's called Putting the Pieces Together, Understanding and Supporting Children with Autism Spectrum Disorder. And in this book, I say that autism is not something to be fixed. But people with autism are people to be supported so that they can see the world in their unique way. The same is true with ADHD. It's not about trying to make a child sit more still, be more calm. It's about supporting them so that they can sit still and be calm when they need to, so that their brain is not firing all the time. But we don't want them to lose that superpower, because with that superpower of being able to jump around all the time, they may be a great speaker or teacher where they can answer questions and bounce off of things. Anxiety even can be used as fuel. If someone has depression, we don't want them to suffer from a disorder, but maybe once they get through the symptoms, the problematic symptoms of that disorder, their unique perspective is one that is much more about listening than about speaking. We don't want to give people diagnoses to say, oh, here's the thing that's going on with them. Here's what we need to do to make them like everyone else. That's not it. These diagnoses are to say, here's what's going on. Here's the support they may need to be successful, but let's do the least amount of change in them that we possibly can to help them be successful and bring their unique perspective to this world. Diagnoses do not define you. Diagnoses are not facts. They are best interpretations. And just because someone shows some symptoms of a disorder does not mean that that is the thing that's going on with them. Hopefully this answer was helpful. Like this video, subscribe to the channel, and leave a comment if you've ever wondered about the difference between symptoms and diagnoses. Here's another question I hear often. Why do kids these days seem so much more emotional and disruptive? What's going on with kids today? Let's break it down, and let's bust the myth that kids today are out of control. It is true that more disruptive emotional behaviors may seem common. But the other side of that truth is that the intensity of those behaviors has actually decreased over time. There was a video I put out a few weeks ago talking about some wins to celebrate in 2024. And in that video, I explained that violent crime rates are down. Despite everything that you see on the news and your social media feeds, violent crime rates for both adults and children are way down. We are seeing some of the largest decreases in violent crime just in 1 year increments. We are seeing some of the largest 1 year decreases in violent crime that we've had since those numbers have been recorded. It's not that kids these days are worse behaved, it's that some of these behaviors are happening much more frequently because they're at a less, much lower, that would be the correct grammar, a much lower intensity. So maybe children these days are throwing more tantrums, but really statistically, they are harming each other less. Or maybe it is that they appear more disrespectful, but their drug use is actually down. In mental health, we measure three things to see if someone is improving. And those three things are the frequency, intensity, and time of behaviors. It's the acronym FIT, F-I-T, frequency, intensity, and time. What often happens is intensity will start to come down, but then frequency and time will start to go up. So the intensity of those disruptive behaviors will go from being violent towards others to then shouting and screaming and tantruming to then being disrespectful. It will show that decrease in intensity over time. But it may be that as it is decreasing in intensity, it becomes more frequent and maybe it even lasts longer. But that shift is still improvement. As a society, we can use those same three things, frequency, intensity, and time, to see how kids are doing. And it is true that teachers these days are reporting much more emotional dysregulation amongst their students. We're also seeing a significant increase in school suspensions. But as far as violence towards each other and violence towards adults, and even adults towards children, the violence there, all of those numbers are coming down. We're seeing a huge decrease in intensity. And as that intensity comes down, it is likely we will see more frequency and that those behaviors may last for longer periods of time. I say all that to say that kids today are actually getting better at managing their emotions overall, even if the challenges seem more frequent. There's a few reasons that they seem more frequent. One is that they are more frequent, that kids these days are more emotionally dysregulated more often. But it is also true that those difficulties in emotional regulation are not resulting in as large of behaviors, as much intensity as they have in the past. Another reason that we're seeing more frequency is that there's an increased awareness of emotions. It used to be in schools, it was just sit down, shut up, and do what I tell you to do. And now we understand that that's actually not the best way to work with kids, even though that dealing with kids who are emotionally dysregulated can be very frustrating at times. I'm not saying that it is not difficult at times to deal with children who are throwing tantrums and having this emotional dysregulation. But what I am saying is that we know that telling them to just sit down, shut up, and do what they're told to do is not the best way for their long-term mental health for them to be dealt with. So that increased awareness surrounding emotions and increased awareness of best practices is also leading to an increase in the frequency of emotional dysregulation, but still that decrease in intensity. And there's also better reporting. There are cameras everywhere. In schools, there are cameras everywhere. If there were cameras in as many places as there are now, as when you and I were kids, if there were as many cameras then as there are now, you and I would have been in just as much trouble as these kids today are getting in. It's just they're being caught more often. It wasn't that we didn't do the things that they're doing, just nobody heard about it. Nobody saw it on a camera. But now it's everywhere. And there are policies now that require certain things to be reported for good reason, because we're catching things at lower levels, at lower intensity, so that they don't lead to a greater intensity. That means that there is more reporting of disruptive behaviors because we're catching them quicker, getting those students, getting those kids the help that they need so that it doesn't turn into a greater intensity problem. So that better reporting and more often reporting is a great thing that is really helpful, but it can seem very overwhelming to hear that all these numbers are going up and all this is happening in our schools and at different sports teams that kids play on or in different clubs or wherever kids might be, that these things are happening so much more often. But it's because we're getting better at knowing the early warning signs so that we can keep things at a low intensity so that they don't grow larger. It's a sign of progress. This lower intensity but more frequent challenges means that we understand kids better and we're helping kids in real time. Do I believe that kids these days seem to struggle with their emotions more often? Yeah, I do. I believe that kids these days are struggling with emotions more often than kids in the past. But I also believe that they're struggling at a lower intensity and that we are quicker to see that a child needs help. We're quicker to get them connected to what they need, and we're doing a better job at keeping it at a lower intensity, even though it may be happening more frequently. Kids these days are not worse. They're just different, and different in some great and meaningful ways that show us we are really making progress. Like this video, subscribe to the channel, and share it if you think it's time to celebrate the progress kids are making. Another question came up to me this week. A caregiver asked me this. I hear about co-regulation all the time, but I'm not sure I fully understand what it means or how to do it. Can you explain? And my answer is absolutely. Co-regulation is one of the most powerful tools for supporting kids' emotional health, but it's often misunderstood. Maybe this is your first time ever hearing about co-regulation. If it is, let me give you just a really basic definition. The basic definition of co-regulation is you remaining in control of yourself to help your child remain in control of himself or herself or their self. You remaining in control of yourself to help your child also remain in control. But there are some myths about this co-regulation. Let me give you a situation and then I'll tell you how some people say you need to handle this situation. If your child is incredibly dysregulated, I'll just use that word, for whatever reason, maybe they are incredibly sad, angry, scared, something happened that they didn't like that led to disappointment, that led to anger, whatever it might be. If they are dysregulated in some way and they're reacting in a behavioral way that you are not supporting, that you are not proud of, you do not want them to react this way. There's kind of a few different ways that you can let the child know that they are reacting in a way that you do not approve of. One is that you can yell and scream and tell them to stop. But if you yell and scream and tell them to stop, that actually very rarely works at all. And long term, we know it doesn't work at all. But very rarely does it even work in the short term to help. It actually causes them to become more dysregulated, or it turns into a fight or an argument or whatever it might be. So, if your child is dysregulated in some way, another way that you can deal with that is to pretend that it does not bother you at all and fake it. Basically, fake it till you make it and pretend like this is absolutely nothing, and that hurts you long term. Co-regulation is neither of those things. It is neither screaming at your child and telling them to stop, nor is it you pretending that you have no emotions about this situation. Co-regulation doesn't mean pretending you're not feeling an emotion. Co-regulation in that situation would be for you to remain calm even though you may be feeling upset, so that your child can see they can stay calm even though they may be feeling upset. To deny any emotion that you have about the situation would not be co-regulation. That would just be that you are able to handle more than they can. But co-regulation means that you are regulating yourself. And as you are regulating yourself, your child picks up on that energy that you are putting out, and they are able to better remain in control of themselves. There are several videos on my channel where I talk about co-regulation and these things called mirror neurons that are in a part of the brain called the motor cortex. It's right behind the prefrontal cortex and in between the parietal lobe and the prefrontal cortex. But that motor cortex has mirror neurons, and mirror neurons are basically our brain's way of communicating with one another. They pick up on all kinds of different signals that a person is putting out with their energy, with their body language, with their tone, with the words that they're using. Those mirror neurons are picking up on everything. If you are just pretending to not feel anything, the mirror neurons see through that. But if you will identify that you are feeling upset, but you are able to stay in control of yourself, that is co-regulation. It shows the child, yes, you can feel this big emotion and not lose control of yourself. It's about modeling emotional regulation in real time, even when you are upset. Kids learn to handle their emotions by watching how you handle yours. I gave the example of a child having a difficult time earlier where maybe they're throwing a tantrum and there are several different reactions that you can give. You can start to yell and scream at them. You can pretend that nothing is going on, or you could look at them and you can say, I know this is a really tough time, but we can make it through. Or it's okay to also say, hey, I am frustrated right now and I need a break. I'm going to work through it and then we can talk more. And what that shows your child is that even though you are feeling these big, difficult emotions, that you are staying in control of yourself. When you fly off the handle, when you say hurtful things, when you punish just to no end, where it's now you're grounded a week, now you're grounded a month, now you're grounded 6 months, now you're grounded the rest of your life, that is not staying in control of yourself. But if your child sees, oh, you know what? They are feeling angry, but they are staying in control of themselves, or they are feeling scared, or they are feeling really sad, but they are staying in control of themselves. That teaches your child that they can do it too. It's not about denying emotion. It's not about just faking that nothing phases you. It's about acknowledging that your feelings are real. But even with those feelings, you stay in control of yourself. When you say, I'm frustrated right now, but I'm working through it, that's how kids learn self-regulation. They see you handle your emotions, and then they know they can handle theirs. I heard an amazing story from a teacher that I had an IEP meeting, an individualized educational plan with. And the teacher said, yeah, sometimes I do get really frustrated with some of the things that are going on in the classroom. And I could tell that she had more to say about it. And I said, okay, so what is it you do when you're feeling those things? Because I hear all the time of teachers who will just deny that they're having any feelings. And then at some point in the day, they blow up. And it doesn't mean that they do anything abusive, but they do something that makes them think differently when they get home later that day. Or I've heard of the teachers that just start screaming because they are feeling upset. And she said, I don't know if this is right or not, but I tell the kids that I need to go use the calm down corner. And she said that she goes over into the calm down corner, which is this little tent that she has set up in the room. And she says, hey, I'm just going to take 5 minutes. And she has an assistant in her classroom, so she's able to just go in there for a few minutes. And she said she goes in there for 5 minutes. She even sets a timer to show how long it's going to be before she gets back out. And do you know what that means to those kids? Do you know how amazing that example is for them? I don't know if you can hear the emotion in my voice of how beautiful of a thing that is for a child to see that an adult is using the same strategy that they are being asked to use when they are feeling upset. And now they see it's okay to do it. It's going to be all right. They're going to make it through, and it's okay to feel however they're feeling. They can stay in control. That is co-regulation. It's acknowledging the feeling is going on, but also acknowledging you are still in control of yourself. And when kids see that, that's how they learn to stay in control of themselves as well. In our world today, sometimes it can feel like adults have to just stay tough. Or because of all the talk about mental health, it has gone in a direction where sometimes people feel afraid to share their emotions because they're afraid that someone might say that that means something else, that because they're feeling sad, they must have some disorder or diagnosis or whatever it might be. But when you can be brave and acknowledge how you are feeling, and then you can also show a child that even with those big feelings, you stay in control of yourself, that is how they learn. When you deny it, or when you blow up, or when you just refuse to acknowledge it, they can't learn how to do it themselves. They'll end up denying it. They'll end up blowing up. They'll end up refusing to acknowledge any feeling that they have or believing that their emotions are bad. But when they see you and they see you take care of it and they see you stay in control, they know that they can do it too. And that is what co-regulation is, and that is how you can use it with your child. Like this video, subscribe to the channel, and let me know in the comments how you have used co-regulation with the kids in your life. There was a question that recently came in on Instagram from a parent, and that parent wrote, "My child keeps saying they're bad because of mistakes they've made. How can I help them separate their choices from who they are as a person?" That is such an important topic, and I'm so glad they asked. That is really what my whole mission is to help adults better understand kids so kids and their caregivers can thrive. And my website is even badkidsdon'texist.com. If you believe that bad children exist, I am here to tell you that is not the truth. And let me also tell you that if you comment on this YouTube video and tell people that bad kids do exist, I will deny your comment. That's my power. So you can do it all you want. I'm going to deny that comment being posted to my channel because it's untrue. Kids who make bad choices are not bad kids, or kids who show disruptive behaviors are not bad kids. And it's so important that we separate a choice from a child. Kids need to know that they are so much more than their mistakes, and you can help them understand that. A poor choice doesn't make a child bad. It doesn't make a person bad, but I focus on kids. A poor choice doesn't make a child bad. And we need to teach kids to reflect on their actions without attaching them to their identity. We need to show them, hey, you did this thing. That's not you, buddy. That's not you. What was going on there? And maybe you'll be surprised with some of the things that they say. Maybe they'll say, I don't know. I don't know what was going on. And you can help them figure it out. But it's so important to tell them, you are not bad. A choice you made wasn't the best choice. And the same is true really for any emotion. You are not sad. You are not scared. You are not angry. You are feeling those things. You are feeling sad, feeling scared, feeling angry, feeling happy, feeling excited, feeling disappointed, feeling embarrassed, feeling envious, all the inside out emotions. You are feeling those things, and we have to help children disconnect those feelings and those choices from who they are as a person. Around this time of year, there is talk about Santa Claus and the nice list and the naughty list. I have decided to say that the naughty list does not exist anymore. And this idea actually came from a professional wrestler. His name is Mick Foley. He was also known as Mankind, Dude Love, and Cactus Jack in the WWE. And he's amazing. I've gotten to meet him a couple times, but he loves Santa Claus, and he also agrees there is no naughty list. It doesn't exist anymore because a naughty list would mean that a child is naughty. So every child is on the nice list, even if they've made quote unquote naughty choices. They are not a naughty child. I decided to write a poem called No More Naughty List, and I'd love to share it with you now. This is No More Naughty List. It's a poem to remember that bad kids don't exist by me, Stuart Mister Stu Perry. It's been said that Santa has two lists to keep up with. The naughty list and the nice list are what they've been called. But what if I told you only one list exists? One list, not two. Well, it just so happens this one list that exists is the nice one, and on it is you. Sure, Santa watches all year and sees all you do, but he sees and knows how tough it can be sometimes for you. We all know it's hard, nearly impossible, to be nice all the time. So what happens then for those who have lied and fought and even committed crime? Santa sees all that too. And no, it doesn't make him smile, but he understands you're learning. After all, you're a child. Nobody's perfect, and we all make mistakes we must learn from. It's part of growing up. You win some, you lose some. So this year, you may be scared about some of the choices you've made. You're thinking maybe Santa sees on the naughty list your name. A naughty choice doesn't mean you are a naughty child. You are not the choices you've made or will make. Yes, still do your best to be nice and kind, for goodness sake. But this year, Santa only needs one list, the one that is nice. As a matter of fact, the naughty list has been gone for quite some time. And yes, that's right, your name is on the nice list because it is such a nice and amazing thing that you exist. Sure, There can be times you've made choices you regret and got wild, times you were yelled at for doing what you were told you mustn't. But in the end, there's a difference between a naughty choice and a naughty child. The difference is simple: one exists and one doesn't. You can find that and more resources at badkidsdon'texist.com or by following me on social media at Mister Stu TV. Hopefully, that poem resonated with you at least just a little bit. And yeah, it's silly. And yeah, it's focused on one version of this holiday season. But it's so important to let kids know that they are not naughty, that they are so nice for just being alive. And yeah, they might make choices that are frustrating, either to themselves or to others. But it's so important to remind them that they are not their choices. They are so much more than that. And it's amazing that they're here. Like this video, subscribe to the channel, and share it with someone who needs to hear this message of unconditional support for kids. My final question I'm going to be answering today is, how can I encourage my child to keep trying when they feel like they'll never get it perfect? Let's really talk about why progress is worth celebrating. In short, progress is the building block, and progress put together is all of the building blocks of resilience. And focusing on that progress helps kids develop confidence and a growth mindset. When it's all about the end product, then kids can sometimes give up along the way because they'll see something that seems too far-fetched and they'll say, I could never do that. But when we encourage them and we are praising them for their progress at whatever it is that they've set out to do, then they will see that they're making strides in that direction. A great thought about this is, if you were to think about Olympic athletes, if someone looked at them when they were a child and they just said, well, you are not Michael Phelps swimming in the pool, so why even bother? Why even bother continuing to swim? Or if somebody looked at Michael Phelps when he was a child and said, hey, you know what? You're not as good as this Olympian. I am not well versed in Olympian names, but if I were just thinking about it, if they just said, hey, you are not as good as this Olympian, so you know what? Just give up. Stop. Quit doing it. Then that would be really tough. And it would also make them want to give up because they would see that this goal was too far-fetched. But if they can see that there's a little bit of progress every single day toward that goal, then they'll be motivated to keep going. When we wait until the end of them reaching their goal before we'll praise them for it, many times they don't reach the end to get that goal because things got too hard along the way and they didn't know that they were so close to achieving their goal, or at least making strides toward achieving it. Another way to think about it is, if you were working really hard at something and this thing was going to take you a long time to finish, and somebody just looked at you and said, well, it's not done yet, so what are you even doing? Like, you need to fix this. Come on, hurry up. You need to go through. Come on. It's not done yet. Why aren't you doing it? You would not want to keep working for that person. Or if you had done a ton of work on a project, but it wasn't all the way finished yet, and you showed it at work, and they said, yeah, but it's not finished, so why even bother? This is stupid. Why are you bothering to show me the work that's unfinished? It would not make you want to keep working on that project. The same is true for kids. If they've set a goal, whether it's about their behaviors or whether it's about something that they want to achieve personally or just something that they're excited for, if we wait for them to get to the end, many times there's tough things that are happening along the way that give them great reason to give up because they haven't seen that anyone is acknowledging any of their progress. We have to recognize small wins because those small wins are what pave the way for big victories. It's not just about what is happening at the end, it's about every step they took along the way. An example of this is I have a client who is getting in very violent episodes with one of their parents. And it was happening frequently, multiple times a week. This child was becoming fairly violent with one of their parents. And we had a safety plan and we made sure that everyone was going to be safe. But these things were happening. And then there was a week where there were no violent episodes, but the child was yelling and being disrespectful and not hurting anyone, but definitely not behaving in a way that this parent wanted them to behave. And that parent called me and they said, "What am I supposed to do? They are still doing all this stuff and it is still so frustrating and I'm not sure what to do. I'm going to lose it." And I said, "Do you see how much progress they've made?" There was another child I was working with who was a kindergartner. And in starting school, they became really dysregulated because they were so scared. And in their kindergarten class, they were throwing chairs and hitting people and biting people. So I went into the school and we came up with ways to keep everyone safe and we figured it out. But then they called me a few weeks later and they said, "They are still being disruptive." And I said, "Oh no, who did they hurt?" And they said, "Oh no, they're not hurting anybody, but now they're cussing and they're screaming. What do we do?" And I said, "You praise them for how hard they're working and you tell them how proud you are of them for not hurting anyone this time. If you don't do that, they'll give up." And the same is true with the kids in your life. If they have set a goal, or if they are working towards something, or if you are helping them work towards something, and you're waiting for the end before you're going to acknowledge how hard they're working, don't expect the end to ever come. Because along the way, something's going to happen that becomes too hard, and they'll say, "You know what? No one has cared about any of this work that I've put in anyway, so I'm not going to keep going." But if every day you find something that they are doing great at and you just praise them for it, it could even be as simple as if a child is struggling to get their homework done and maybe they don't do a whole sheet, but one night they just decide to do one problem of one sheet. Can you praise them for that even though they didn't get the whole sheet done, even though they didn't turn in all the homework? Can you just look at them and you can say, "Oh my goodness, you got one done tonight. Wow, that is so great. How in the world did you even do that? Oh, I am so proud of you." And then they'll smile and maybe they'll do a second one. Or maybe they won't, but they'll know that their effort was worth it and that they are getting closer to achieving their goal. When kids feel supported in their journey, they're more likely to keep trying. And we have to remember that perfection is not the goal. Learning and growth are. Support learning and growth with the children in your life, and you will see them keep learning and keep growing. If you refuse to acknowledge how hard they are working and you don't say anything about it, don't expect them to keep going because nobody wants to work that hard for nothing. Praise the progress, not just perfection. Like this video, subscribe to the channel, and comment with one way you've seen a child make progress recently. From understanding what a diagnosis really means to celebrating progress over perfection, these 5 insights can transform the way we support kids' mental health. I'd love to hear your thoughts. Drop a comment below and let me know which part of today's episode resonated with you. If you are kind, I will be happy to approve your comment. If you are rude, it will get deleted. Don't forget to like, subscribe, and share this video to spread these ideas to others. Thank you for being part of this conversation today. If you are looking for a keynote speaker or workshop leader to help your team or organization better understand kids, head over to badkidsdon'texist.com/booking to learn more about the programs that I offer. I would love to make your next event or training an absolutely fantastic one. Until next time, this is Mr. Stu reminding you that some things exist, some things don't. Bad kids don't exist. Peace.